like drinking from the fire hose.
Gunderson Executive Vice President Michael Dolan says most medical students aren't prepared for the heavy workload.
They just give you so much information in such a short period of time, and the expectation is you master it, you get tested on, and you move on to the next thing.
Students are expected to work even harder when they become residents, with many interns working 80 hours a week.
80 hours is still double what most people work in a typical work week. But that's better than the 115 hours a week that I worked when I was an intern.
On top of the long hours, physicians know if they make one mistake, it could cost someone their life.
People expect perfection 100% of the time, and that's really impossible to achieve. And there are always going to be instances where we don't make the perfect diagnosis, or we don't pick the perfect drug to treat high blood pressure or diabetes.
Unfortunately, all of that stress makes it more likely for doctors to mess up.
If your physician is burned out, you have a higher likelihood that they're going to make a mistake.
Partly because of the high stress, every year around 400 physicians end their lives, according to the American Psychiatric Association.
Those individuals, if you look at the statistics and at the data, the majority of them actually start as burned out, then become clinically depressed, and then commit suicide.
But Dolan says there is hope if hospitals spend time and money fixing the problem. They can improve morale and prevent suicides.
And it's pretty well documented that if you put effort and attention to it and commit resources to it, you can reduce burnout among physicians.